Ladies and gentlemen, we're going to allow us, I'll start softly to allow a few people, if they are making their way from lunch, realizing that they're in the wrong place and this is the place to be. I'll give them a minute or two to arrive. So my name is Tamsin Rose, and I'm the Senior Fellow for Health at Friends of Europe, so I'm in the right place, at least, for our conversation this afternoon. And our topic today is Health is the New Europe. Now, I have spent 20 years working on health at EU level, and for 18 of those years, we've spent our time trying to say, hey, health matters, it's important. Surveys of citizens show they care about it. And then a little something came along that started a global pandemic, and we no longer have to make that case. Health clearly is the new Europe. And what we're going to do in this session today is we're going to explore together what this means and how we move forward. This morning's sessions looked at the unprecedented amounts of money that's being raised for Europe to build its recovery and resilience plan, and we're going to explore where's health in all that? What does it actually mean? And I'm delighted to be joined by a number of experts here in the room, and I have two speakers online who I'll be able to introduce to you. And as the rest of the day, it is a hybrid event, so we have an audience watching us on Zoom and on a live stream. And we'll be bringing them in, and my colleague Josephine, who's over there, is our curator for our online moderation. She'll be bringing in the voices of people and their comments and their chats as well. So, let me start by introducing the first member of our panel, and that's Mario Monti, who's very well known to us at Friends of Europe, a friend of the House, but is also, more recently, the chair of the World Health Organization's Pan-European Commission on Health and Sustainable Development. Also a former Prime Minister of Italy, also former Commissioner at the European Commission level. So you have really seen a number of different important political positions. But you received a phone call or a message from the WHO, and they asked you to come in and help them explore the way forward. When you were previously leading a government, to what extent did you get involved in health? And now, what are the lessons that you've learnt as a result of your commission? And if you had a hotline to the heads of government of Europe, what advice would you be giving? Because they're now having to get their hands deep into health. It's very clear there's no way that health is now off the political agenda. So what's the benefit of your advice?
Well,
let's press the microphone.
Thank you very much. That is a very accurate and timely question, because one of the proposals coming out of our Pan-European Commission on Health and Sustainable Development is precisely how to change the position of health in a permanent way in the way of operation of domestic politics in each country and of global policies. So, if I had the hotline to the heads of governments, our Commission did have that hotline because, to be very specific, one of our key proposals is that the G20 should set up, for the first time ever, a global health and finance board at the G20. This, as you might know, the G20 this year is chaired by Italy. And the Prime Minister of Italy and his government have now made it official that this is a high priority for their G20. Negotiations are well advanced. There will be, at the end of October, a decision, I hope positive. There are still oppositions, but the idea is that now, okay, all health ministers are proud and scared at the same time of being so central in policy making. But one needs a way to crystallize this momentum and to make sure that also next year, in 2 years from now, when maybe other great international concerns will dominate the agenda, still work will go on. And why health and finance? because as we know, finance ministers are quite at the center of policy making. They are normally, in practice, the number 2 to the head of government. Not so for health ministers. And so we need, also in the interest of finance, not just in the interest of health, to make this coordination much stronger, also in the interest of finance, because if inadequate investments are given to health, then we see not only the human catastrophe, but also the economic and financial catastrophe. So this, let me close with one parallel. 10 years ago, now this time a global public good, public health, has been broken down. 10 years ago, a totally different global public good was also broken down. That was financial stability with the financial crisis. The G20, under Gordon Brown, the British Prime Minister, reacted promptly and set up the Financial Stability Board. The first chair of that was Mario Draghi, then governor of the Bank of Italy, and that was very instrumental in changing the laws, the regulations, and in avoiding so far a second financial catastrophe. So why not to take example from this concrete historical experience? Of course, always keeping the WHO at the center of the system.
Thank you. So your first key message is to introduce a mechanism that marries health and finance together so that we never again see them as opposing forces and in conflict, but as mutually supportive, because I think the pandemic has taught us a very sharp lesson in that respect. Thank you, and we'll come back to you with more input later. Let me introduce our next speaker, and that's Jean-Luc Lemercier, the Corporate Vice President for Europe, Middle East, and Africa, Canada, and Latin America at Edwards Lifesciences. Now, life sciences are part of the jewel in Europe's crown. And we saw that just how valuable that is in terms of our research and our development, because many of the vaccines that the world is now using were made in Europe. So clearly its strategic importance to Europe has been recognized. What I want to ask you is perhaps the same question I asked Mario, which is now that we've got the political attention at the highest level, and there's more financial resources being allocated to health, how do we leverage this opportunity to achieve real change?
Thank you, Tamsin. I think, as you mentioned, I am a business leader specialized in health and more specifically in cardiovascular. So I'm not going to talk about the huge spectrum of health, but just cardiovascular and what we have seen over the last 2 years. What we saw is something we didn't know. We knew before COVID that cardiovascular disease in Europe is the first killer for the population in Europe. So this is a fact, we knew it. What we have learned with COVID, this portion of the European population has been dramatically affected by COVID in terms of fatalities. All the publications coming out now are saying that about 60% of the fatalities related to COVID have cardiovascular disease. So you have a sort of combination with a disease which is already the #1 killer, and during the period you get another toll on this population because of COVID. So what you learn in this type of situation, first you regret to have this disease, the #1, because it's a pretty high toll on this population, and you ask yourself what has been done, what have we learned? And to have the #1 cardiovascular, to have the #1 killer in Europe not fully addressed by Europe compared to other diseases like cancer, like diabetes, is something which is strange. So the opportunity we have today within this cardiovascular disease is probably a unique opportunity. You have a sort of, and I'm sure this year, 21, will be a point of inflection with this disease and the relationship with Europe. The first thing we have now is, and Professor Monti already elaborated on this is money available funding. And for this health, the Health for Europe program is there now. 5 billion, 6 years. It has never been so high. So it's a first opportunity. The second element we have in Europe, you have already a lot of solutions to address this cardiovascular disease. The only problem, the mobilization is not enough. We know how to detect, we know how to treat, we know how to monitor. Everything is there. The technology is there, the staff is there, they are competent. The third element we have in 21 is all the major stakeholders taking care of this disease decided to join effort into an alliance called EACH, European Alliance for Cardiovascular Health in Europe. And who are those stakeholders? The number one is European Society of Cardiology. They are mastering this disease. You have the patient, the European Heart Network patient, which regroup cardiovascular patients at the European level, and you have industry. Our industry, medical device, and the branch specialized in cardiovascular is engaged in this alliance, and you have the farm industry, their cardiovascular portion as well is engaged. So this is the four the four major entity. In addition, you have 10 other entities which join this group to make something very compelling to address the disease. So you ask yourself, why are we so worried? What's missing in this alignment is political engagement now. And this is what we need to mobilize over the coming quarters, because we think there is a sense of urgency, probably an opportunity with COVID and cardiovascular, and we need to engage now. We need to have the support of policymakers to make a movement against this cardiovascular disease. And we had a lot of debate in the group of this alliance, and the element, the most important we think today for cardiovascular is detection. The early detection of this disease needs to be accelerated. This is a disease which is underdiagnosed. This is why you have so many people dying. We have the technology, we have the knowledge, we know how to do it. So something was missing, the money, the commitment. And we need the commitment of the political to move on this disease seriously. We cannot live with a disease killing so many Europeans without having action deliberate against it. And recently, the WHO published something which was very interesting, not specific on cardiovascular, but what they are saying is targeting screening plus early detection is a good element to prevent disease. And this is exactly what we are asking for with this, in this situation. So what I hope with this conjunction of elements almost aligned is to have further commitment of policymakers, which has to be material, and the commitment could materialize like cancer to say all the population which is 65 years old should get heart check in all Europe, mandatory, financed by the system, and do it. And this is one element of the policymaker can make. The second element is probably to have this money, this funding somehow allocated to cardiovascular. And what we'd like to see is probably some pilot across Europe, starting early detection with this money. Some countries have already done that, like Italy. Italy has a program which is cooking now there to have early detection of cardiovascular disease. And I'm sure some other country can do that. So this is what I wanted to say, Tamsin. This is a special moment. It looks like funding is there. The stakeholder, again, which are combating the disease are regroup themselves to make efficiency. Now we just need the call for the politician to say, we know this is serious, we are going to do something.
Excellent, thank you. So implementing what we know is effective and moving further upstream in terms of prevention, screening and diagnosis. Let me introduce the next member of my panel to give us some insight, and that's Johannes Schildt, the co-founder and CEO of Krech Livi, and a European Young Leader for the 2021 program here for Friends of Europe. Now, you work in the digital innovation and health sphere. And COVID was like pressing on the accelerator, because health has been slow to adopt and roll out digital, and suddenly it all had to happen. And you operate in this innovation space, but we often are very critical that Europe doesn't produce the world-beating companies as elsewhere. So let me ask you, as a young startup company in digital health in Europe, what would you like Europe to do to make it easier for you to go global, to scale up, and really achieve the potential you see?
It's a good question. As you said, the pandemic have definitely accelerated already existing megatrend. I think for us, we do digital healthcare, so we operate at scale across Europe. We're now the largest digital healthcare company in Europe, helping millions of patients across the different member states. And I think from a patient perspective, and that's where we started, and I started myself. As everyone else, I had my fair share of healthcare, and I'm fairly frustrated on how it's structured. It can take you weeks to see a GP, and it takes months to get a referral. We just thought it must be better ways of structuring it, and that's the path that we're on. And to simplify it, we do mainly primary healthcare directly on your phone. So think about it as a clinic directly on your phone. And from a patient perspective, I think that the European patients have been ready for this for quite some time, to be perfectly honest. When we initially started in Sweden back in 2014, patients have fairly quickly been adopting it. But operating at scale in a pan-European setting definitely have its certain challenges. It's a highly fragmented market, obviously. I think one of the key challenges is that you touched upon that also in the reimbursement models and the payer models. I think how healthcare is structured right now is structured around physical care. And we clearly see that the vast majority of things that are now happening, and especially in the first line of defense in primary care, could perfectly be done with same medical quality and outcomes in a digital setting. But the reimbursement models and how healthcare is structured from a commissioning perspective, that's very local. And that is obviously challenging for us, because even in a small market as Sweden, it's divided into 21 different regions. They all run under a different reimbursement scheme. There's usually, there's different kind of old legacy technology in the back end that you need to adopt to and work with. And digital at its core, there's no borders. My aim is to create a European healthcare system. Not from a product perspective, nothing is really stopping our service to be accessible for all Europeans. That could be done. We have doctors speaking more than 30 different languages. The language barrier is not really an issue. I think the barrier for us to really scale is that healthcare is now sort of where we pushed into this very local setting, and that is a shame in one way. But we think we as a company are also managing well to handling that kind of complexity, but creating an easy way for us to access more patients at the same time that will obviously accelerate it. And I think that from a European perspective, and not only talking about ourselves, the sector in general, I think that we still have a fair chance of as Europeans being in the forefront of this change from physical to digital when it comes to healthcare provisioning, yes.
So there we need to balance the tension between local services that are managed locally, they're delivered locally and meet local needs, and the fact that, in fact, for a plug-in system, a system that works, you have to have some standardization, you have to have some principles, some frameworks that could apply equally in a small town in the north to a big city in the south.
Because that's the beautiful thing, like you equalize access. In Sweden, we can access everyone, so everyone in Sweden can access our services as a part of the public system. And it's, as you said, it's equalizing access. It doesn't matter if you live in a remote village up north or if you live in downtown Stockholm. And that's, from a practical level, you can create exactly the same kind of infrastructure and system on a European level. From a technical perspective and from a product perspective, that's not the blocker. It's the regulatory side that is the blocker here.
So I'm just intrigued about how this worked. Did you change the back end so it fitted into the multiple municipalities, or did the municipalities change the way they worked so it fitted with you? It's a bit like the European plugs. Did we change the plug, or did we tell the manufacturers to change what they did?
It's a good question. We do a bit of both. So you both have to adopt to the local setting. I think in Sweden we've managed to operate on a nationwide setting, so we actually helped create the nationwide reimbursement model, but we also operate within the different regions. Now in France, we operate district by district, which works obviously, but you don't have, as I said, practically you could have all the French people access our service as the part of the public system, but now you have, probably half of the districts you can access it. So I think it's a bit of both. Like how we have been operating is that you can't really sit and hope that the world around you will change. You just have to act. That's how we operate. So yeah, but obviously there are things that we all can do together to help accelerate the sector in general, obviously.
I'm sensing in what you make it sound so easy, but I'm sensing multiple pain points for your team in the way you just said, yes, we adapt to our local. I can feel that.
Well, it obviously is, but I think it's from our perspective, that's part of the strength of it. I think, we are operating in healthcare. It's ultra complexity. It's a market by market exercise, obviously. It's also, local rules and local regulations. we understand that, and we have always been willing to roll up our sleeves and go really deep in understanding the different pain points of the different systems, obviously. So I don't think there's any way around about being slightly local, but obviously, as I said, one of the beautiful things with digital healthcare provision and digital care is that it is scalable, and it's just a shame if we can't utilize that really. But no, we have, I think, how we've been operating is that we have, as I said, we can't just sit and wait and hope that the world around us will change. We have to act even though the models will not support it. And when we initially launched in Sweden, there were no payment models for it. Like there were no one willing to pay for it really. Like we launched and we have been subsidizing it ourselves. Same now during the pandemic, we have been releasing a lot of free versions of our tools because we have been the right side of a global pandemic. We said, let's do whatever we can to be helpful, and then hopefully things will follow, right? So, I'm not frustrated, but I think there's definitely things that we could do as Europeans to accelerate it, and because the mega trend is total, that is there, right? And if we look in the world, like we have some large US companies, we have some large Chinese companies, and they obviously can access more patients at the same time, but I still think we have a fair chance as Europeans to be thought leaders and to continue to be in the forefront of digitalization of care. Yeah.
Okay. Thank you. I'm sensing a consistency across the messages from all. Mario invited us to get the health and the finance ministers together at global level, so we've got more coordination and alignment. Jean-Luc invited us to have more of a vision of understanding what's actually causing the mortality and morbidity burden in Europe and to align with that. Mario, did you want to add something before I move on?
Quick psychological observation. One could guess that the world of health, health ministers, WHO, would be simply delighted to be put more intimately in contact with the world of finance. This is not the case. The difficulties are coming, or were coming, until very recently, from the health world, because of their historic, perceived, perhaps not totally wrongly perceived, lower hierarchical position relative to the world of finance and the heads of government. So those who are going to benefit the most have been the most reluctant to this cultural and political change.
Thank you for that insight. That's very interesting. You mentioned, being proud and scared, the health ministers, at being at this high-level table. Let me now introduce one of our participants from online, and that's Aleksandra Torbica, the Director for the Center for Research on Health and Social Care Management at Bocconi University. And let's pick up a little bit on the glorious diversity of Europe. If you look at the different countries, they have different political regimes, they have different ways they organize the health system, different policies, different reimbursement mechanisms, different demographics. Given all of that, how do we do governance at European level? How do we strengthen health governance, given this marvelous diversity and the stories that Johannes told us about, even at local district level, how challenging it was? Aleksandra, do we have you on the connection?
Yes. Hello, everyone. Thank you so much. You can hear me well?
Yes, we can. Go ahead.
Thank you. Thank you very much. Thank you also for, of course, for the invitation, but also for this question. This issue of pan-European governance of health is really close to my heart, not only for my interest in comparative international research, but also because of my origins, which is that from the Western Balkans, as it's been classified in the pan-European region, Republic of Serbia. So I have been always personally and professionally keen in understanding this matter of coordination beyond political boundaries of Europe and European Union. The pandemic has unfortunately confirmed this notion known to everyone, the disease knows no borders. So the virus has been really blind to our differences, east, west, north, south, poor, rich. When it comes to health challenges and health emergencies, our destiny is the lives of the European, but not only European citizens in a geographical dimension are intertwined. So as a consequence of that, the main message, one of the main lessons that have emerged, that we cannot achieve a resilient pan-European region without solidarity and better cooperation across. At the level of the European Union, a lot has been done even before this pandemic emergency. European Union then was able to leverage on these tools that have been developed in the past. Like, for example, in the EU, we already had an apparatus for communicable disease control, European Center for Disease Control and Prevention, ECDC. There are plans of developing an agency, Health Emergency Preparedness and Response Authority. European Union has invested large amounts of resources and in pharmaceutical development, in health systems through the EU for Health program, and so on. These are all very valuable assets that also the pan-European region at large will be able to benefit to a varying extent. However, I think, and also the discussions that we had at the Pan-European Commission for Health and Sustainable Development that was mentioned before, that additional concrete actions should be taken at the Pan-European level in order to strengthen this governance. Some of the proposals that have come across, very concrete actions, are that of establishing a pan-European network for disease control that would leverage and act somehow as an extended reach of the ECDC to strengthen early warning system, epidemiological and lab capacity. But what is very important and links to our previous speaker, digital solutions for interoperable data systems. I strongly believe that we should prioritize investments in data sharing and data interoperability platforms across pan-European regions. Even though that there is no doubt that pandemic is one of the most measured events in the history of humankind, one of the greatest challenges that we had, not only at the pan-European level, was to have meaningfully comparable data across the countries. Even just comparing the scale of the problem at the beginning was very difficult and complicated because of the differences in the definitions, data collecting, reporting. Even now, months after the pandemic has been around, it is not so clear and it's not that easy to get truly comparable measures of access, all-cause mortality in a timely way. And even though we have now criteria how to distinguish between deaths because of COVID and deaths with COVID, those rules are not uniform across the countries. So think about, the tests and the type of tests that are used across pan-European regions, how we compare the results coming of those technologies. Now we have vaccine passports, green passes. These all really require much more investment on common definitions and standards, what kind of data to collect and to share, and digital solutions are really, really crucial to make this happen. On a more political dimension, one of the proposals was that to establish a pan-European Health Threat Council that will put together ministries of health across the pan-European region and at occasion heads of state in times of crisis. The main aim would be to promote cooperation between legislators and executive agencies in the pan-European region. So to make the long story short, I think it's clear to everyone that no country can do this alone. We need this multilateral rules-based system in which everyone recognizes this interdependence, and more specifically within the pan-European region. And it goes beyond political and economic dimensions. We, and I mean the entire European region, pan-European region, are connected with something even stronger. So going back to the title of this event that was nicely also mentioned with our host at the beginning, health is the new Europe, or should be the new Europe. We have paid such a high price to learn this lesson, and I really hope that we will not let it waste. Thank you so much.
And thank you, Aleksandra. And as you say, health is the new Europe, and we will pay a very high price unless we get ourselves better prepared for the future. Let me now introduce Mina Gaga from the Greek Alternate Minister for Health Services, because I'd like to pick up on a new messaging that's emerged as a result of the pandemic, which is this concept of strategic autonomy for Europe. Can you give us a sense of what that might mean in health? Obviously, we found ourselves very vulnerable to supply chain disruptions and other things. To what extent is strategic autonomy for health useful as a concept? Is it workable? We live in a global world, and as for disease surveillance, we have to be part of this. What does this concept mean for you? We can't, I apologize, we can't hear the sound here.
Sorry, can you hear me now?
Yes, that's it, go ahead.
I need to switch the mic on. Well, anyway, I think we've all seen during the pandemic that we do need to be autonomous in producing things like PPEs and medications during the COVID pandemic. But we had seen this before because there were always shortages in medications, for example, for anesthesia, many medications, and there had been an EU cost action to deal with this and provide proposals to deal with this. So autonomy in Europe is possible more or less if we schedule production. And as far as expertise, medical expertise goes, Europe is totally autonomous. On the other hand, healthcare is a totally different thing because you can be autonomous within Europe, in the whole context of Europe. But as Aleksandra already said, services can be totally different, not just from one country to the other, but from one region of a country to another. And life expectancy, even within London, can vary by about 4 years, according to where you live. So digital telemedicine and digital innovation can help greatly. And it can help diagnosis, it can help delivery of care wherever the citizen lives. It doesn't provide solutions for surgery. It doesn't provide solutions for other specialized things. And this is something that we really need to take care of. And also, I think, as president of the European Respiratory Society, we ran a survey to patients, asking what they realize as possible sort of good outcomes and also threats in healthcare. And I think they found that the new, very, very important things is telemedicine. Apps can help them. The information that is available through the internet can help them. It can also cause trouble because it's not always very based on facts and that. But also I think the things that we really need to remember in Europe at the moment is that we really need to deliver personalized care, but also think about multimorbidity, which is more and more the case as people get older in Europe. So we've talked about cardiovascular disease. Cancer is another pandemic. We lose 1.3 million people per year in the EU, and we have 2.7 million new cases per year in the EU. And we really need to make a very good balance between the overall European autonomy and strategy and national or regional healthcare delivery, and also, importantly, prevention. So I think we have a lot of things to discuss. Health, I believe health is the new Europe. You have to, first of all, make sure that people are healthy. They live healthy beyond the age of 40, and in some countries they don't. They already have a lot of multimorbidity at a very young age. So these are things that we need to see. We have a lot of new technologies and new medications, personalized molecular diagnostics, all kinds of things which also come with a very high cost. And cost is something that needs to be sustainable. Mr. Monti already said that. Finance ministers and health ministers need to work together, and there have to be agreements on how much we should spend on health, which is a prerequisite for whatever we do. So I think we have a lot of things to discuss. Also, the environment around us is changing. We have a climate change, which will also affect health. We have a lot of things that change around us. So whatever model we agree on and whatever autonomy we agree on, this has to be an evolving model because things around us change. I think these are the things that I wanted to talk about. So I think the expertise in the EU, as far as medicine and health is concerned, is there. It's not available everywhere, so we need to make it more widely available. During the pandemic, we could work together, and I think that's why we arrived at results so quickly, because all results were reported to the WHO. We treated patients, and everything we found out was immediately reported. So information and sort of integration and cooperation are there. We just need to structure, I think, things and make sure that we can deal with technologies and the cost and really coping with the needs and the whatever the patients need, not just disease-wise, but also person-wise. I think that's what the important message is.
Thank you very much, Mina, for sharing your thoughts and again reminding us that we need to find a balance between the European level, strategic planning and the local autonomy to be able to deliver according to the needs of different populations. And again, reminding us that not everyone lives in the same level of good health or life expectancy, even within one city. So there needs to be this flexibility to meet local needs and the priority again around screening, prevention and promotion. Let me now turn to our online audiences and bring in my colleague Josephine. She's been watching what's been happening in the chat and on the Twitter feeds. What's going on online?
Thank you very much, Tamsin, and thank you, everyone. So we have a good number of people that would also like to intervene from the online chat. I would first of all like to bring in a quote card from our Debating Europe citizen platform. So a question from Brusso from Italy, who is asking, how can we deal with the backlog of patient cases built up during the pandemic? So obviously this is quite of a broad question to all our speakers today. We also have additional people that would like to come in and join the discussion. I'd first like to call in Mr. Ashish Kumar Gupta, who is the Corporate Vice President at EMEA at HCL Technologies, who would like to talk about the role of technology in helping creating a healthcare system which can do more with less and deliver better care faster to citizens. So, Mr. Gupta, could I invite you in?
Yeah, thanks a lot. Good afternoon. Fantastic conversation so far. In fact, some of the things which I wanted to talk have already been discussed, right? So I think all of us sort of understands. I'm going to sort of talk about a couple of topics, right? The first is that pre-pandemic, I think there were studies which said that the, percentage of spend, on a GDP basis, in healthcare was about 13% and go to about 20-odd%. And these are pre-pandemic figures, right? And the pandemic has obviously told us that health, has no boundaries, and there is actually significant amount of sort of enablement which can happen using technology, right, at the heart of solutions. So I think Johannes talked about the fact that there's lots of innovation happening at the edge, right, to start driving change, right, in the delivery of technology, providing better access, right. There was also a discussion around the fact that data itself is very siloed and very, very disparate across multiple systems. Actually, as a company, we work with a lot of organizations, helping them transform and adopt digital, right, in technology. So my experience in working with a lot of healthcare system providers across Europe has been that it's very fragmented, right? And, the digital maturity of the healthcare system is actually, at a much lower level than what you'd find in a lot of other industries. So the point I'm making is that actually with technology, right, and with the amount of sort of, things which we can do with data, right, and all of the secularization which has happened using technology and, provision of technology at scale, there's a lot more which can, underpin the new Europe, using the technology in health, right? Okay. But that will mean not just innovation at the edge, it will mean change from the core, right? Each and every part of the organization which constitutes the healthcare system in Europe needs to really become more mature on using technology and driving it, forward. Is what I would propose as a possible solution.
Thank you very much. So taking the innovation that's happening at the edge and bringing it into the core. I think we have another couple of interventions. Can I invite them to be brief, because I'm going to be coming to you in the room next to also comment in that. Who else has suggestions about how we make, health is the new Europe? So, Josephine.
Thank you, Tamsin. I thought I would also invite Dr. Krech, who is the WHO Director of the Department of Ethics and Social Determinants of Health, to come in, and then Dr. Josep Figueras, who would like to intervene on the informal Council of Ministers which happened in Slovenia 2 days ago. Excellent. So, Dr. Krech.
Thank you very much, and indeed, an exciting discussion going on. I just wanted to come back to Dr. Monti's intervention, saying that, you know, the ministers of health have a sort of ambiguous role here now. So before the crisis, they always said, well, we're not important enough, and then now they say, oh, we're perhaps too important. Now, the issue is that health is, in many countries, the biggest economic driver anyway. So we see the growth of global health expenditure, let's say from 2000 to 2018, at a range of 8.3 trillion US dollars, and that equals about 10% of global GDP. So health is therefore a big economic driver, but it's also instrumental to social welfare as such, and thus a key objective of economic policy. So this is something that I think the health sector has still to grapple with, the importance it had also before the crisis. We in WHO have advocated for a health in all policies approach for many years, because we see the impacts that decisions in different sectors have on health had been or are huge, and the crisis that we've seen in 2005 with H5N1, in 2010 with H1N1, with Ebola in 2015, and with COVID now in 2020, is really a wake-up call for the world, which it has not yet actually heard. And this is something, therefore, if I take the importance that health has in economic terms, we know that half of the chronic diseases could be prevented by public health measures. And we know that looking at the health risks that can lead to future pandemics are vast as well. So we need really a joined up government to identify these risks so that we in our lifetime will not see another pandemic. But I'm very doubtful that this will happen, or that this will not happen, because we have so far not seen a really fundamental shift in designing our societies, which is needed to prevent future pandemics from happening and to give health promotion and disease prevention of chronic diseases the place it deserves. So with this, back over to you, moderator.
Thank you very much. And it's clear that we have failed to implement what we know in terms of prevention and promotion. And it's clear that the current disease burden that made our populations so vulnerable to COVID, and Jean-Luc highlighted his strong connection to cardiovascular, the fact that we haven't managed to tackle that meant our population was more vulnerable to COVID. So there's a need to implement what we know. And this brings us back to the question that we asked at the beginning, and I asked Mary if you had a hotline to the heads of government, what they should invest in next to implement some of the things that you've raised that we know about, reducing the risks, reducing the social inequalities. Let me bring in one more person online before I come to the audience. And we are inviting you all to reflect on what are the decisions that we make about strategic and smart investments, so we have a population that is better prepared to withstand what we've just heard. There's good news, we're in Europe coming out of this pandemic. Bad news, there's another epidemic, possibly pandemic, coming, and we know that. So let's prepare for that. Josephine.
Thank you very much, Tamsin. So the next speaker I would love to invite is Josep Figueras, who is the director and co-founder of the European Observatory on Health Systems and Policies. But before I invite Josep, we have some very good comments in the chat, and one from Greg Jones from Coventry University, who is interested in an angle around future skills, education, training needs for healthcare workforce shortages. And he's asking, how can these be addressed through better coordination at EU level, given the diversity in healthcare systems already referred to by the different speakers? So as well as this, he's interested in the role of the EU in supporting this as part of its global agenda, and asking how can this be coordinated. But now I would give the mic to Josep. Thank you very much.
Thank you, Josephine. Thank you, Tamsin. Actually, my comments tally beautifully with what Tamsin said at the end and what the commentator said as well. And with Rüdiger as well, and many of you. I mean, I'm a bit less optimistic like Rüdiger is today. It's not just about additional funds, colleagues. It's about transformation, as you've been saying, is how do we allocate those funds to the right places, as has been said just now, a skill mix, training, and many other areas. And I wanted to highlight, obviously I will not speak at informal councils, confidential. I was there presenting the work of the Observatory with the presidency, precisely on the issue of implementing innovation for resilient health systems. And the emphasis of the presidency is transformation, implementation. Remind ourselves, colleagues, that many of these innovations were there and they were implemented very quickly during COVID. Can we harness that energy, that innovation? Can we sustain and maintain it? Because I'm not that sure. So throwing money on it is not going to be enough. The presidency, sorry? The presidency is put together, the piece you can download now is launched before yesterday. We looked at the various instruments and tools at European level to support member states. Very interesting. The big money is not in the EU4Health program, even if it's 5 billion now. It's in the cohesion funds, it's in the DG reform, it's of course in the recovery and resilience facility. So we need to harness this money to support health, number one. Number two, we see already the recovery and resilience facility sort of suggestions from member states. And we see a lot of digital, we see primary care, good news. We see some skill mix training, good news, integration, good news. But in the area of digital, it's not just the gadgets. It's not just the technology. It's the culture, it's the regulation, it's the training and the support. Let's remember to put the monies there, colleagues. The point that we'll not mention in the informal council was confidential, but in the Slovenian presidency, which was open, member states seem to want to work together within subsidiarity, within subgroups to help each other to support, to innovate, and put these things in place. But second point, very briefly, Tamsin, because I know you're running out of time, which I like to echo very much Professor Monti and Professor Torbica points. Remember, it's not investing only on One Health as the beautiful, excellent report, Monti report is put, but the Monti report, as Aleksandra said, is also beyond One Health. Remember, it's not only COVID viruses that cross borders. All health shocks, many health system shocks cross borders. The refugee crisis, financial crisis, the need for procuring the pharmaceuticals. So we need that global governance and funds to go in other areas. There's many voices now and today saying it's not just the virus, colleagues. It's not just the pandemic, colleagues. There are many other areas that Rüdiger was saying that are as important, and we need to put the monies and share the governance, surrender some of our sovereignty within subsidiarity, which is totally possible, to try to handle those together. Thank you, Tamsin.
Thank you for that, Josep. And I'm going to come back to you, Mario, on this one, because we just heard there the call from Josep to say it's time for us all to grow up a little, share a bit of sovereignty, and be aware that the virus isn't the only thing that crosses borders. Health is truly a European level issue, whether it's procurement, it's supplies, it's logistics, it's training, it's mobility of health workers. And let me sort of make that link to the issue of the social contract, which we're very interested in at Friends of Europe. And that's about what citizens have as a reasonable expectation from their governments and what they should be putting into and receiving in return. We knew even before the pandemic, surveys of citizens show they consider health a priority, and they want Europe to do more on health. but Europe feels constrained by what the treaty says it can do, and member states didn't want to do something. Now we've got this political opening. How far do we go? How far do we go in terms of saying health is something too important to be left to the desk of individual health ministers, who are both scared and proud to be now up at the top level? How much room do you think there is for radical change at European level to see health as something that is too precious and too valuable to be left in its silos?
I believe that if we deal with this topic as a governance issue, what we see is that we need greater integration full circle, because we need greater integration between health ministers, the heads of the governments, finance ministers. By the way, the notion that the WHO has had for a long time of health in all policies, I subscribe to. Perhaps that so far was lacking the force and the actors to make it a reality, because you cannot just say health in all policies if where all policies sit, there are not high-level, open-minded political personalities at the receiving end. And what with our modest report we have been trying to do, and I thank again Josep and Aleksandra for their enormous contribution in different capacities, is well, to produce something on health that maybe, perhaps, might end up on the table not just of health ministers, but also of heads of governments. Then the other aspect of integration is exactly, so it's not to be left to the individual health ministers, because it will have all of these topics to be a concern for general policy making in each country. And at any rate, it cannot be left to either the health minister or the head of government or the finance minister of individual countries, because this clearly requires at least European, if not global integration. Actually, for certain issues, European or pan-European, for other issues, global. Is this going to, how far can you go? Is this going to happen? Well, a few years ago, when I think it was the Juncker Commission conducted an exercise asking member states how much Europe would you like to have? And it described different intensities of Europe. In a very light Europe and not very costly Europe, there was even the idea that those very limited competences on health that the EU has, or even more had then, maybe should all be repatriated. So not health at all at the EU level. Look retrospectively with the eyes post-pandemic to that. So clearly, sensitive topics are candidates to be considered priorities of national sovereignty, as it was for money, as it was for border control, as it was for health until now. But I see a striking similarity. For me, it's easy to think out of the box, because I'm afraid I belong to no box, certainly not the box of health. But I see huge similarities, cross boxes, between the process when the finance ministers and the central bank governors in the 80s realized that they had lost already monetary sovereignty because only the finance minister of Germany and the central bank governor of Germany were sovereign. They could decide on their interest rates, and all the others had to follow within half an hour, otherwise capital would flow. And then, after self-flagellation, they came to the idea that perhaps it was not a lost honor to decide to share that appearance of lost sovereignty at the table of a European Central Bank. This is a vision of Europe which goes back to what Jean Monnet said. I hinted at this morning. We need crisis, not to say that we should not work against crisis or that we should facilitate crisis, but it's a simple, almost mechanical balance between the cost and the benefit of surrendering an extra kilo or centimeter of national sovereignty. You need to have something much more visible than ever occurred in the past that may persuade the holders of that national sovereignties to give up and share.
Thank you for that. And again, the insight is just a reminder to look back at how far we've come and how we could very well have gone down the other route where there was zero capacity at Europe to be addressing these issues. Let me see if there's anyone from the room who'd like to intervene and provide some contribution on this issue. We're exploring the role for Europe in health and how we can build into this new vision of health in the resilience and recovery package, health as a central element. So anyone who'd like to intervene here from the audience? If not, I'm more than happy to keep asking our panel to share their views. And I think we could listen to Mario for hours telling us stories about how Europe has changed and progressed. Jean-Luc, you told us about the new Alliance for Cardiovascular Disease. And this is looking at how we can pick up and generate political momentum to draw the political attention to an issue that should get more attention. It's the #1 killer. And yet somehow it's missed the visibility mechanism. Mario's explained that sometimes you need a crisis, sometimes you need a jolt to get political attention. By bringing together the different organizations, do you feel you could give the jolt to get the political attention on this big issue?
As I said, to have movement, you need either to have a crisis and a planet alignment with a major element which can create the movement. It looks like the moment is there. We have that this year. And this alliance for cardiovascular health in Europe is the first time we have been able to get together. You have 15 association entities in this group, all engaged. That it never happened. What I have to say, we have been witnessing a lot of dynamic among this group, which we were sort of surprised at the beginning. We thought we would have only 4 or 5 groups. We have 12 or 15 now with us. So there is some, either we have a backlog of action, which is well identified by this group, and a willingness to act. So and this group represent all the stakeholders, so which means it's going to be difficult to resist. It's really this group is getting movement, and it looks like we are getting movement. We have a good dynamic, I have to say. So,
thank you, Josephine. I'm going to bring you in. Loubna, did you want to say something? Okay, Josephine, and then I'll come to you, Loubna.
Thank you very much. Just very quickly, we have Francesca Colombo, the head of the health division at the OECD, who would like also to join the discussion. Francesca, can I invite you to join this debate?
Sure. I have 2 main points that I wanted to add to this very helpful discussion. First, concern the health finance dialogue conversations and the global health architecture as well. I think there is a window of opportunity. The G20 ministerial declarations from health ministers has recognized health as an investment. And as Mario was saying, of course, there is a discussion about possibly setting up a global threat, boards that brings together health and finance. So that's definitely an opportunity, but there are risks, and possibly there are two risks. One is that this even role of an institution, assuming this is going to be agreed by G20 ministers, remains limited to purely pandemic threats and narrowly defined issues about pandemic, as opposed to looking also at the fundamental task of health system strengthening, which is so important. We have seen it in the current pandemic, to make sure that the health, but also the economic and social consequences of the crisis can be properly addressed. So I think that's something to bear in mind, how do we enlarge the discussion? And secondly, the other risk is that this appetite and enthusiasm from Minister of Finance for health as an investment might be short-lived once Minister of Finance realize the full scale of the debt related to COVID-19. And again, there is an opportunity to make those sort of transformations in health systems which are required to bring health systems into the 21st century. And they've been mentioned, the digital transformation, the prevention, primary care, and so forth. But the window of opportunity may close. So we need really to act fast. At the moment there is money, there is an intention also to invest in health, but that might close. My second point relates more to the role of Europe, and quite clearly Europe, in the context of the pandemic, has taken a more of a global dimensions, including going beyond what was traditional, the remits of the role of Europe in relation to health and health systems. But there is no global health strategy as a whole for Europe. And I think there is probably an opportunity and needs to reflect about that. What does Europe want to achieve in the global health space? How can those objectives be used to then strengthen the international presence and role of institutions which are more European, including the ECDC, the EMEA, or the new agency, the HERA? What are the strategic partnership and approaches that needs to be put in place, and what type of reinforcements through leveraging the multilateral system can be also put in place? I think there needs to be more reflection. Sometimes I have the impression that there is a discussion about health systems, and there is discussion then about the global health, and Europe very present on health systems, but it's unclear what strategically are the objectives in the global health space. So what's the global health strategy of Europe?
Thank you very much, Francesca, raising some really valuable points for us to reflect on when we think about Europe's role in the world. And let me invite other people from the room if you'd also like to share. Loubna, let me invite you to come in.
Thank you, Tamsin, and thank you, speakers, for the insightful discussion. And hearing this and thinking about Europe's sovereignty in healthcare and the lessons learned and how it happened in the finance sector in the history. So if we look at the pandemic and how the virus showed that there is no borders for the virus, and also not related to one organ and multiple organs. And if you look how we manage healthcare today, it's not only in ministries and every member state deal with their own health, but also within every country we look at, there is the border separation already, and within the countries it's every organ differently. So where is the human being here? So we don't look to the citizen as an individual. We don't treat him as an individual if he moves borders, or if this is spread from one organ to another. And I think that is really the moment to rethink our approach. And if we look to the power and how we can be competitive in this industry, we saw the lesson that data is the new currency. And if we look at the data landscape today, because of these borders and because of the organs and the specialties, we cannot get hold of the data. It keeps running, flowing away. So I think we should really rethink the way we do it. And if there is a kind of a European initiative to standardize that and to get us to look at the citizen and the individual as a whole, and to generate this data and to create a data that we flow with us if we move from one place to another, if we are treated from one specialty to another, and that we're being treated as holistically. And I think this is the moment, and the reforms always come either big reforms, either with the big changes politically or also with big health pandemics or so I'm hopeful that this will bring big changes into healthcare in Europe.
Thank you. Johannes, can I invite you to pick up on this point that Loubna just raised about, in health, the medical specialties divide the body into organs and different pieces, so it's fragmented, the data is fragmented, and in Europe we also do the same thing, but the organs all work together in the body and people move across borders. Yeah. This is an area of your speciality. How do you see Europe developing this data landscape?
Well, I think from our perspective, as you said, it should be always centered around the patient, and as I said in the beginning, we started purely out from a patient perspective, and I think that's something very powerful, and that's how all healthcare organizations and healthcare companies should operate, right? We never really thought about it as sort of how is the system structured, to be honest. A lot of what we do would be in the bucket of primary care, but personally, I don't really like that term, because what you put in the bucket of primary care varies vastly between different markets. What we thought about is that, you have patients that are worried, you have patients that need of help, and we should create a product that solves their needs. We haven't really thought about, when we're building this, we haven't thought about how is the reimbursement model structured, or how have the existing system defined it. I think that you have a lot of healthcare companies that are building systems for the system itself versus thinking about who are the end consumer here, the patients. And we always started out from our own perspective as patients, and that's how we've been building things. Then obviously, in order to be successful, you obviously need to serve all stakeholders. You need to create something that is great for not only patients, but also for the clinicians and also for the payers of care. But that's always how we have thought about it.
Okay, thank you.
Just go then. I can understand from the tech side we can have a holistic approach, but the education of doctors are already starting. If you go to a surgeon, he wants to operate quickly. If you go to internist, so the education is very specialized and organ-focused. So even if we try to solve it from tech side, that we can have it holistically, still we have. So I think there is verticals, but there is also a horizontal, the way we educate, the way we train, and the way we organize our healthcare system around it. Thank you.
Thank you. We're coming towards the end of our time, and I'd like to ask Mario one last question, because we've had two key themes that have run through today. That's the green transition and the digital transition. And obviously, when you were looking at the pandemic response and advice about the strategic investment for the future of health, where do you see the role of digital in all this?
That was to whom?
That's to you, Mario.
Oh. Digital is you.
Data is Johannes. Big picture.
He does things.
Yes. Well, when you were looking at healthcare systems and building their resilience and making sure they work more effectively, COVID was the big accelerator, and we went online in health in a way we haven't for a decade.
I'm sure these various transitions are more complementary than competitors with each other. It might appear that they are competitors for funds and for attention, but I believe that they all benefit from a cultural change which is more or less the same for all: the digital transition, the greater attention to health, and of course the green transition, the energy transition. And again, all these imply that decision makers, both in the industrial world and at the political level, have to do two very unnatural things. That is, to have a longer view, both in terms of timing, and try to liberate the decision-making processes from the tyranny of the short term, but also in terms of space, and do not pretend that there are local or national solutions to issues that are international and global. And no, I think I'll stop here with this very generic answer, which, however, in my mind, alleviates a concern that I always had, namely that you either do good policies in one respect of these transitions at the sacrifice of the others, or you sacrifice B in order to work on A. I think they are complementary.
Thank you. I'd like to now draw our meeting to a close. It's been a really great conversation. I want to thank all of our participants online, those of you here in the audience, and of course, people sitting here with me who shared their insights and reflections. We started with a very bold message that health is the new Europe, and I hope we've come to the conclusion that this is going to be the new status quo, and there are requirements on us all to be part of co-creating this new vision, because it can't be left to either the heads of government alone or the health ministers to co-create what we want from our society, what we expect from it, and how we change our healthcare systems. So thank you all. Your next appointment is after a coffee break at 3:45, and that will be also here in the library, where we're looking at the future purpose of foreign policy and diplomacy in a changed world. Enjoy your coffee break. Thank you all.